I'm Dr. Ben Newman. I try my best to answer science questions. I really do. Yeah. I'm a coronavirus specialist. Yeah, I've worked on these viruses for years. All right. Yeah. Enough about my weird life choices. Let's get to your question. This question is from Debbie. How you doing, Debbie? Let's see. So, Dr. Ben, do you think that portable air purifiers with HEPA filters are helpful? They're helpful, they're not harmful, they won't necessarily keep you safe, but they help a little bit and maybe not in the way you think. All right, let's read the rest of the question and then we'll get into that. So I was thinking of putting one in my parents' room at their nursing home. Okay, yeah. This is a much more dangerous situation where something like that would... So you must like your parents. That's very good. I'm glad that you're trying to take care of them. I like that. Let's see, they have caregivers 24/7. Good, yeah, nursing home should have. Although there's different levels, right? Yeah. And staff coming in and out all day. Yeah, that's bad, but those people have to go home and pick up the kids or eat dinner or whatever as well. So I understand it, yeah. So if somebody tests positive, they quarantine in a section of this facility. Yeah. And that's not great, but that's probably like the best that can be done in that situation, I am guessing. I really, yeah, I don't like that idea because your average nursing home attendant is not your average biosafety level 3, COVID ward nurse. There is extra training involved and extra experience, and yeah, you got to be a little more on your toes. It's nice that people are helping out. It's nice that they've found some way to try and keep everybody in the best possible care, but yeah, I don't know. That seems like a recipe for a larger outbreak, having the people that are sick around the people that are vulnerable in a different part of the same building, because nursing homes are not set up as hospitals. They do not have the airflow, they do not have the filtration, they do not have the sort of sealed walls and doors that you would want from a facility where you knew you were going to be dealing with COVID-19. And it's it's like keeping a couple bad apples with your good apples. The bad apple just go gross and brown and get all over the place and kind of make the other ones disgusting. That's the risk, I think, there. Anyway, that's not your question, is it? Your question is about HEPA air purifiers. So the HEPA's fine. It's going to do its job. The problem is, if it is like any of the nursing homes that I have visited, it's probably going to be warm and fairly still, because among the older people that I have known, they generally like it warm and uncomplicated. Yeah, that seems to be kind of like the inside of an incubator where you would grow cells. It's just a good way to grow people. Yeah, at a certain point. That still air, that lack of extreme movement of air, that is a problem. So we know that coronavirus cases are associated with an infected person just like passing through one of those areas or being in one of those areas temporarily, and then the virus will linger. The larger droplets will actually go out and they'll fall. They fall at the rate of a couple millimeters per second. But little droplets of 5 to 10 microns, if I'm remembering correctly, will actually hang in the air. They don't ever hit the ground. They just float up there and eventually evaporate. And these can definitely have SARS coronavirus 2 inside of them. So the air purifier, it's purifying a little bit of air, but I think the big advantage there is that you're moving some of the air around. You're building in some airflow. And I don't think it's going to be enough, and I would say you'd want to have a couple of great big fans, maybe pushing all the air out of the room. That'd probably be a good thing. You're kind of generating a positive pressure suite, which is one way that they do biocontainment. It is a way, where you keep bad stuff from coming in, and that would appear to be what we're trying to do here. So That's what I would do. I wouldn't just stop at an air purifier. The air purifier is okay, but I'm more interested in like the fan and blowing mechanism from it. And I would say any way that you can amplify that doesn't just completely annoy your parents, yeah, would be good and would keep them a little bit safer, especially as you say, since there may be actual COVID-19 patients in the vicinity. And it is possible, although I would hope not, but it's possible that you would have somebody who has cared for a COVID-19 patient and then presumably changed gloves and maybe scrubs, but then coming and doing other jobs around the facility. That would be a worry I would have. And it says that some of these go to a local hospital in Shreveport. I'm guessing it's only the severe cases they probably send there. But yeah, that's how I would handle it. Maximum airflow. Yeah. So there you go. You want to see your parents' hair just like constantly look like when those models are doing shampoo commercials and waving their hair around. You almost want it to look like that. Yeah. So or take them out for a day visit in the wind tunnel. Maybe go one of those things where you do fake parachuting indoors, where you get above one of those big fans that just blows you up in the air, and you can hang out there. Yeah. Maximum airflow, masks when dealing with outsiders, and I like that you're trying to keep them safe. That's actually really nice. And best of luck. It can be done, but it takes some thinking and some effort, and I like that you're putting those in. So thanks very much. This has been Ask Dr. Ben.